Hello again. I'm Dr. E. Barry Gordon, and this is the fourth video in my series about testosterone deficiency, a debilitating and ultimately fatal disease that will eventually affect almost all of us, yet one that is vigorously ignored and neglected by the medical community. Today I'll finish discussing testosterone the hormone, this time examining what it does to us, or rather, for us. The first thing testosterone does is make male babies. Early in our embryonic life, we're all physically females. The greater production of testosterone in those genetically destined to become males causes the masculine body changes. Tissues that become the clitoris in the female greatly enlarge and form a penis. Strings of tissue attached to what will become ovaries in a woman. In the male-to-be, they shrink and contract, and in doing so, pull the gonads down and out of the pelvis into what would have been a woman's vaginal lips to become the testes inside the scrotum. To make the story complete, women have the same type of erectile tissue in the clitoris to make it swell and become rigid as men have in their penis to bring on an erection. And men, with their would-have-been vaginal lips fused together to form the scrotum, even have residual vaginal tissue buried inside. So you see, the sexes are really not so different. We'll go over this again in a future video when we discuss the sexual problems related to testosterone deficiency. The next major role testosterone plays affects both sexes. The beginning of substantial secretion of testosterone by the testes or the ovaries, along with estrogen and progesterone in women, is the onset of puberty. In both sexes, testosterone initially promotes rapid bone growth and muscle development, and then ends bone growth. In both sexes, it matures the sex organs and creates a desire for sexual activity by its effect on the clitoris in women and the semen-producing glands in men. The fact that men manufacture about 10 times more testosterone than women accounts for their greater growth, size, and strength. Is that all testosterone does? Certainly not. Testosterone is commonly known in medical circles as the anabolic hormone because of its potent effects in adults of both sexes to maintain and rebuild bone and muscle strength and to keep us fully energized. It maintains our sexuality, both our interest in the activity and our physical responses. None of these things I've said about testosterone are controversial or even recent discoveries. It's all basic biology. Yet it is so common for patients to not only be completely uninformed about the role testosterone plays in our lives, but also badly misinformed. One of the most serious bits of misinformation is the common belief that testosterone has little or nothing to do with women. The facts are right at your fingertips. The following comes directly out of a popular online encyclopedia. Quote, testosterone is a steroid hormone from the androgen group. In mammals, testosterone is primarily secreted in the testes of males and the ovaries of females. Quote, in both men and women, testosterone plays a key role in health and well-being as well as sexual functioning. Quote, the following are the first visible effects of rising testosterone levels in childhood and occur in both boys and girls at puberty. Adult-type body odor, increased oiliness of skin and hair, appearance of pubic and armpit hair, and at the adolescent growth spurt and accelerated bone maturation. And finally, quote, adult testosterone effects are more clearly demonstrable in males than in females, but are important to both sexes. They include sexual desire and mental and physical energy. It's important for you to fully grasp these fundamental facts about testosterone. I'm going to repeat these encyclopedia quotes in a future video. Testosterone has many other functions, most of which are still unknown. It can have major effects on our mind and our mood. It affects our sugar metabolism, our cholesterol, our arteries, our blood, and likely even our lungs. I think it will ultimately be shown that testosterone has positive effects on the immune system, and likely even works to prevent some cancers. What is needed is a truly massive research effort to uncover all of the effects of testosterone in both sexes, something that has been grossly and sadly neglected. In video 5, I'll be presenting my general view of the role sex hormones play in our lives and discuss the issues of sex hormone loss and replacement. Check out my website, www.thehiddendisease.com, and learn more about the disease of testosterone deficiency. You can also view and download all the earlier videos in this series. And finally, as I ask at the end of every segment, if you think these videos are of any value, email them to everyone on your address list and ask them to do the same. Tell your friends and relatives about them. Show them the videos if necessary. It would likely be the biggest favor you could ever do for them. I'm Dr. E. Barry Gordon. Thank you for watching.